Well, good afternoon. Today, Leamington and Kingsville have joined the rest of Ontario in the safe reopening of their beauty salons, barber shops, patios, and shopping malls. I'm so proud to say today all of Ontario has entered stage 2. This was made possible because we worked together as a province. We made sure that no one was left behind. And I want to thank the good people of Leamington and Kingsville for their patience and cooperation. And I want to say a special thanks to both Mayor Santos and Mayor McDonald for their leadership. My friends, we're making steady progress, and now we're looking ahead. We're preparing for the next step, the next stage of our reopening, and we're doing this carefully and thoughtfully. Because you just have to look what's happening south of the border to see the consequences of moving too quickly. We will continue to chart a responsible path to economic recovery that protects the health and safety of everyone. So today, our government is bringing forward legislation that would allow us to lift the provincial declaration of emergency in the very near future, while continuing to give our frontline healthcare providers the tools and powers they need to keep us safe. Powers like limiting long-term care staff to working at one home, allowing public health units to redeploy staff for contact tracing, and enabling the construction of temporary healthcare facilities. These are measures that give our frontline heroes the flexibility to respond quickly and protect those in their care. And as we move forward, we will continue to keep you informed. You will always know what I know. You will see the same information I see. This legislation will not allow us to create any new emergency orders. They can only be amended or removed. And I will continue to provide you with updates on the emergency measures from this podium, because it's important now more than ever that we keep working together as a team. For all of us to be pulling in the same direction, and together we will get this province back on track. Thank you, and God bless the people of Ontario. Now I'll pass it over to Solicitor General. Thank you.
Thank you, Premier Ford. Good afternoon, everyone. Since declaring the provincial emergency on March 17th, our government has taken careful and measured action to protect Ontarians. The provincial declaration of emergency supported our comprehensive response to the COVID-19 outbreak and allowed us to create emergency orders to address critical needs as they arose. It provided a temporary platform for decisive action that carried Ontarians through unprecedented challenges and helped us to initiate the first important steps of reopening the province. As a result, businesses are putting Ontarians back to work. People are safely reunited with loved ones, and communities are finding new ways to come together again. Ontario is on the path to recovery, and we owe this progress to the people of the province. It is our responsibility as a government to continue to take careful and deliberate action to ensure their hard work, their sacrifices, will not be undone. While the provincial declaration of emergency may come to an end shortly, the danger posed by COVID-19 will continue for months to come. That is why today our government introduced legislation that, if passed, would support our continued efforts to cautiously reopen Ontario in a way that recognizes the COVID-19 impacts may be felt for an extended period of time after the declaration of emergency ends. It would allow Ontario to continue its path to recovery by easing restrictions where appropriate, while maintaining important select tools to address the ongoing threat of COVID-19. The proposed legislation would bridge the gap between the public health measures that were necessary to respond to the initial and immediate threat of COVID-19 and those now needed to support Ontario's safe recovery. This would include the ability to extend and amend certain existing orders, such as those related to labor redeployment, workplace rules or practices, restrictions on gatherings and events, closure or regulation of businesses, and compliance with public health advice. However, as mentioned by Premier Ford, the government would no longer have the ability to create new orders. Since the beginning of this emergency, our government has acted on the guidance of public health experts and the evidence that continues to be gathered day by day. Any updates to the orders under this proposed legislation would continue to be informed by public health advice and our resolve to fight against COVID-19, support frontline providers, and ensure the health and well-being of all Ontarians. This evidence-based advice would also guide our government in determining when it is safe to revoke certain emergency orders maintained under the proposed legislation. Ontarians have responded in extraordinary ways over the past months to help stop the spread of COVID-19. We must not allow the progress we have made to be undone. Our collective resolve and vigilance will ensure, beyond the immediate dangers we continue to face and the ongoing threat of a second wave, if the data changes and the threat grows, our government will not hesitate to explore and exhaust all options necessary to protect Ontarians. This includes enacting new provincial declaration of emergency if the orders maintained under today's proposed legislation are unable to guarantee the necessary protections. Led by Premier Ford, we will continue to take balanced action that allows Ontario to respond quickly and prudently as the situation evolves, while supporting communities and businesses at every step of the recovery process. Thank you.
Okay, we'll go to the phone line for questions. First question.
Sorry.
First question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi, Laura.
Hi, Premier. I just wanted your thoughts on your new legislation to continue extending these emergency orders. Can you explain why you may need to do this for a year? And correct me if I'm wrong, but it would also give you the power to do so for up to 2 years. So can you tell the public why we may need emergency orders for another 2 years in this province?
Well, there's certain emergency orders that we have to continue on, protecting the most vulnerable people, for example, in Ontario, making sure that the government can move quickly on issues that really are issues that we can't wait to drag it out for 3 weeks. If we have to make a quick decision on long-term care, for example, we have to make it to make sure people are protected. But, you know, Laura, you know, I'm transparent. Everything that's going on, I just come out here and tell you. But why don't I pass it over to the Solicitor General, and she can explain it further. Thank you.
So the proposed legislation would allow us to extend certain orders, and frankly, it's just as the Premier alluded to. You know, I don't think there's anyone in Ontario who wants to go back to a full shutdown, and the orders that we're putting in place ensure that in measured ways, we can make sure that we protect certain regions or certain businesses if the need arises. So that the ability to react and respond quickly is what we are bringing forward. But we also want to bridge the gap between saying the declaration is over imminently, but we do need certain restrictions to continue to in order to protect all of Ontario residents. Thank you.
Follow-up.
And Premier, I just wanted your thoughts on something related but a little different. A group of current and former public health leaders have written a letter saying Canada's goal should not be to get to 0 cases, but that we need to learn to live with this virus and proceed with a wider reopening, including a full reopening of schools. What is your reaction to that?
Well, I'm not a health expert. You know, I would rely on our health table, and I'm going to rely on our Minister of Health, and I'll pass it over to the Minister of Health there. Thank you.
Well, we've seen with the very cautious approach that we've taken so far to reopening the economy that it has been successful when you look at the fact that we only had 112 new cases today. What we don't want to see happen is to open everything up all of a sudden and then see the public health impacts that may come from that. We may see a situation where if people stop doing all of the things that they've been doing with the physical distancing, the hand washing, the wearing a mask, if you can't do the physical distancing, We know that there could be significant concerns with respect to that and wider transmission of COVID-19 that could very quickly overwhelm our hospitals in a way that we've very fortunately avoided up until now. So the public health doctors that are providing us with advice are advising us to continue to approach cautiously and slowly so that the health impacts can be measured at every step along the way. And if changes need to be made, we can of course do so.
Next question.
Next question comes from Lucas Meyer from News Talk 1010. Please go ahead.
Hi, Lucas.
Good afternoon. Thank you very much. And I actually have questions for the health minister as well.
Great.
Minister Elliott, 2 straight days now below that target of 20,000 on the testing side, including around 15,000. I'm just wondering if this is concerning to you, or is there evidence to suggest that this is just a blip right now?
No, this is not concerning to me. This is generally what we see happen at the beginning of the week because the test volumes over the weekend are just not as high. People are doing other things. They're not going in to be tested. That tends to happen with human behavior more during the week. So we have seen this at the beginning of the week every step along the way, but I am very confident that our numbers will go up significantly higher again towards the end of the week.
And Minister, do you suspect the province will increase the social gathering limit before stage 3, or will it happen in conjunction with stage 3? And kind of a part B to that question, do you have any idea if there's a number in mind, if we'll go from 10 to 20 or perhaps 10 to higher?
Well, the public health doctors who have been advising us are asking that we proceed in stages and not to do things incrementally because they really want to see the effects of everything that we've done in a particular stage on its effect on public health. So it's going to be something that will happen together with stage 3. The increase perhaps in the number of people for stage 3 is something that's being discussed right now as the data is being analyzed. But you will be able to expect as time goes on that the numbers of gathering, people involved in a gathering can be increased. I can't advise you of the exact number right now, but that's what's currently being discussed at the health table.
Next question.
Next question comes from Travis Danrash from Global News. Please go ahead.
How you doing, Travis?
Hi there. Hi, Premier. How are you?
Good. How are you?
I'm good, thanks. We continue to hear from healthcare workers who say protections that they should be afforded are being diminished due to existing emergency orders. This is a message that I got from a senior staff member at a GTA area hospital. Quote, our managers are simply taking advantage of this time to manipulate us in ways they deem fit. Some workers are being threatened, forcefully redeployed against their will, or permanently laid off if they fail to comply. What do you say to workers who are concerned about the existing order and what this new legislation will mean for their rights?
Well, before I pass it over to the Minister of Health, my job is to protect every single worker, and I think we've been doing that. It's unfortunate if that is happening. I haven't heard of that widespread. I talked to a tremendous amount of frontline healthcare workers, but if it's happening, it's unacceptable in my opinion, but I'll pass it over to the Minister of Health.
Well, we all know that the frontline healthcare workers are really the heroes in this whole system, going to work day after day, putting themselves at risk and their families at risk in some cases of catching COVID-19. What we want to do is protect them every step along the way. We've done that with the provision of personal protective equipment. We've done that with respect to making sure that even if some of them are redeployed into other areas, such as long-term care homes, that they take that personal protective equipment with them. We have worked with the Hospitals Association, Ontario Hospitals Association, and with the employee organizations to make sure that anyone that is redeployed in either any other part of a hospital or to a long-term care home is doing that willingly. Nothing that's happening in within this act is going to change that. In fact, what we want to do is to continue to protect those workers and to make sure that we can keep them safe. That is going to continue to be our major priority, and we would not diminish that in any way.
All right, my next question is again for Premier Ford. So Premier, I'm sure you saw the pictures last night outside Mayor John Tory's condo and also at Queen's Park. There was a protest there. Tenants are fuming over Bill 184. I want to know what you thought of the tactics that protesters used outside Mayor Tory's condo, and also what you say to them who say that their rights are being trampled, that this bill, Bill 184, does not protect them, and they are afraid of eviction, something that you promised they wouldn't have to face.
Well, let's start off with Meritorious residents. There's an unwritten rule out there, and maybe they didn't read the unwritten rule. You don't go to someone's house. We've had them at our house, but you just don't. It's not fair to the neighbors. It's not fair to the people in their neighborhoods. I had them show up on Christmas morning, on New Year's morning. Just, if you want to protest, come down here. Protest all day long. Come out to City Hall. But I don't care what politician from any political stripe, you just don't go to their private residence. Their family has nothing to do with it. Meritorious free game. When he walks out that door, I'm free game when I walk out the door. But don't harass families. And as for the protections, we do have protections for tenants. Actually, we're going after landlords. If someone has been wrongfully kicked out of their apartment or condo, whatever it is, we're going after the landlords. So I think they're spinning it, but I'm going to protect the tenants. I'm always going to protect the tenants, but that's part of that bill, as you'll see, is protecting tenants and going after landlords if they falsely kick someone out. Let me give you one example. So a person's living at an apartment, and the landlord comes out and says, well, I have a family member moving in, or I'm moving in, and all of a sudden they find out they just got kicked out and they're putting new tenants in. They're going to be charged. We're going after them viciously. So, and then there's quite a few other things that we're protecting tenants. That's my priority.
Next question.
Next question comes from Sean Jeffords from the Canadian Press. Please go ahead.
Hi, Sean.
Good afternoon, Premier. I wanted to ask you about your emergency measure legislation, and specifically how you would respond to critics who would say that the powers that are granted your government under this bill could lend themselves to quite a serious overreach, and they were really only meant to be used over the short term. What would you say to those people who say this is, as I say, a broad overreach?
Well, I respectfully disagree. We haven't abused that power at all. We've been transparent. I'm out here every single day. I tell the powers and what we're doing every single day, and it really comes down to making sure we help the people of Ontario. This isn't going to be, I'm dead against big government. I'm dead against the big brother nanny state telling you what to do. That's just not me. But if we have to help the people of Ontario get through this, there's certain things that we got to move, and we can't sit around and wait 3-4 weeks. We got to move in hours, as you've seen.
Follow-up.
Well, you talk about not wanting to delay, but where do you strike the balance here in a democracy? And in bringing these measures that you're talking about at the cabinet table, which is behind closed doors, to the legislature to be debated and to be vetted by the opposition and the public.
Well, fair enough. We can debate all along, but we're doing it to protect the people of Ontario. That's what it comes down to. And hopefully we'll move on very shortly once we pass the legislation, and we'll be done hopefully by the end of July sometime, maybe. I'll confirm that. But on the overall state of emergency. But as the Solicitor General said, there's certain orders that have to continue just to protect the people.
Next question.
Next question comes from Tina Yazdani from City News. Please go ahead.
Hi, Tina.
Hi, Premier. Hi. I wanted to get your reaction to videos circulating online of people refusing to wear masks when entering businesses or even hospitals. Today, masks were made mandatory in indoor public spaces in Toronto. And I also want to ask if you think this rule, if it was mandated by the province, it would give it some more authority and lessen the burden on businesses.
Well, again, you go into a hospital, you have to wear a mask. I saw the video on that, and it's unfortunate, but wear a mask. You're protecting everyone in the hospitals. These are frontline heroes that are working, and they just can't chance it. And if you're going into a mall or wherever, anytime I go into a large area, as soon as I step out of my car and I'm going into a group or a store, the mask goes on instantly. So just follow the guidelines, and I think it just benefits everyone. And the only thing I've heard is people that may have breathing issues or respiratory issues, they feel stigmatized. I heard from a couple people about that, but not too many. Because a few people, when they went into the store and they didn't have a mask on, and they had asthma, respiratory problems, all of a sudden people would walk by and say, "Where's your mask? Where's your mask?" It's unfortunate. You almost have to wear a T-shirt that says, I got respiratory problems.
Follow-up?
And I just wanted to follow up on the testing question. Second day in a row below 20,000, but what is the testing strategy moving forward? What groups are being targeted? And I know over the weekend that number tends to go down, but given that there should be more targeted testing, why are those numbers still going down?
Well, before I pass it to the Minister of Health, I'm so proud of our testing team. We're leading the whole country on testing, even per capita. And they fall short a little bit because of the weekend. The numbers don't come in right away. But can I be frank with you? I never hear the media saying, "Way to go, you did 32,000, 30,000, 28,000, 27,000. These guys are champions. And overall, we've tested, and the minister can correct me if I'm wrong, but it's 1.5 million people. And they're like a well-oiled machine. But over the weekend, as the Minister of Health said, people are doing other things. They don't want to get tested. But we're going to continue being vigilant. And we have an incredible team right now. They're a well-oiled machine, and everything's running tickety-boo. So I'll pass it over to the Minister of Health. Thank you.
Well, we are doing extremely well with our testing strategy, and generally are running at about 25,000 tests per day. As I said, after the weekend, there is generally a bit of a slump in the numbers because of the numbers of people that show up to assessment centers to be tested because they're worried if they've been perhaps in contact with someone with COVID or they have some symptoms they're unsure about, then they go to be tested. That doesn't happen in the same volumes over the weekends. So I think that's the reason why you see that bit of a slump. But we're going to increase our testing. We're going to move it forward up to 50,000 tests per day as we get into the end of the summer, into the fall, when we start getting into flu season, because we know that our testing volumes will need to increase as people will unfortunately fall ill. They won't know if it's flu or if it's COVID-19. Then they will be going to the assessment centers. And so we know that we need to increase the volumes. We already have a strategy in place in order to do that, and we're moving forward with that strategy.
Okay, next question.
Next question comes from Robert Benzie from the Toronto Star. Please
Hi,
go
Robert.
ahead.
How you doing, Robert?
Hi, Premier. I'm good, thanks. I'm good. Premier, a lot of, you're facing a lot of people asking questions about a pandemic power grab. And the Conservatives that I talk to privately are the ones who are the most concerned about this, because they say that, this is not what a Conservative government should be doing. A Conservative government should be about smaller government, less intrusive government. I'm just worried if you're worried about maybe facing some kind of a backlash within your own party for these emergency measures that you're going to give yourself.
Something that's totally misunderstood. We're doing it to help the people. I don't want a power grab. Robert, you know me. I'm just not into big government. I'm just not, but we have to do it. And the reason we've been successful, and when I say we, I always talk about the people of Ontario, not the government per se, is because of the measures. And without the support of the people of Ontario in these measures, we wouldn't have the numbers we're doing. I just want to remind everyone, again, I know I've repeated this, but I'll say it again. They showed me a map of all large jurisdictions in North America comparable to Ontario, and we're just kicking butt in a positive way. We have the lowest numbers anywhere in any jurisdiction, and a large jurisdiction, mind you, anywhere in North America. And I give all the credit to the people of Ontario, their health teams, public health, everyone. And so, and the other thing is, I come out here and tell you what's going on. There's nothing to hide. We're doing it for the right reasons.
Under the Reopening Ontario Act, as my reading of it, it looks to me that you could extend these orders or entrench these orders for 2 more years, which would take us right to the next election. Do you think that that's what's going to happen, that Ontario is going to be living like this till the next election?
No, I want this wrapped up as soon as possible, to be very frank with you, Robert. That's the quickest thing to do. Let's wrap it up, and let's make sure we're safe and the healthcare workers can move forward and get the job done that they've been doing for us for the last few months.
Okay, final question.
Last question comes from Lisa Sheng from CBC. Please go ahead.
Hi there, Premier.
Hi, Lisa.
We're hearing of a lot of residents in long-term care whose rooms are 25, 26, 27 degrees Celsius, that there isn't proper air conditioning in some of these facilities, and their families are concerned. And right now, air conditioning isn't mandatory in these homes, and considering these are vulnerable people, should the province be making air conditioning mandatory in long-term care homes?
Well, yeah, I think so. Imagine being stuck in there, 25, 26 degrees. I'll jump on it. Give me the homes, and I'll be all over it. I'll pass it over to the Minister of Health. But put yourself in that position. And these poor, vulnerable people, the elderly people, are sitting there, and what can they do? The stuff like this bothers me. Give me the home. I'll call them personally, because we got to do it. Put the investment in to make these people comfortable. I can't even imagine. Could you imagine being on the second or third floor when all the heat rises? It's no different than going from your basement up to your top floor and you don't have AC. That's terrible. I'd like to follow up. I'll get Ivana to follow up with you, because I want to track these guys down. Put air conditioning in. Man, that drives me crazy. I'll pass it over to the Minister of Health.
Well, certainly, as the Premier has indicated, we want our residents of our long-term care homes to be safe, of course, and comfortable. And living in that degree of heat is absolutely not comfortable. We want to do that, so I certainly stand behind the Premier's response that he wants to be in touch with them and urge the owners to put in air conditioning. We know that with respect to fans, there has been some concern about transmission with the movement of air and droplets and so on, but we need to find another solution, and we need to make sure that these very vulnerable citizens are safe and comfortable, and we need to take whatever steps we have to take to get them there.
Follow-up?
Thanks very much. And as a follow-up to that question, you're saying you want to take steps to change that. Right now, it's not in the Long-Term Care Act. So does that mean you would consider amending the Act to include something that would make air conditioning mandatory?
I'd consider it. I'd like to get these owners that don't put air conditioning, I'd like to stick them in the room for 24 hours of 30-degree heat, see how they like it, or put their parents in there. This is all about the dollars. Well, if we're going to change it, we'll change it. That's frustrating, and I apologize. I didn't realize there's a number of homes, but now, since you mentioned that, I'll find out how many homes don't have AC in this weather. It's unacceptable, especially the ones that have 2-3 stories. I can't even imagine the amount of heat that's going into these rooms. It's terrible, and these poor elderly people, they can't defend themselves. That's our job. And thank you for this. You just made a difference, by the way, so thank you.
Thank you.
I appreciate it. Thank you so much.